presentation is brought to you by the Beljanski Foundation. Over 50 years of research towards curing cancer the natural way.
Hello, everyone. So once again, my name is Dr. Larisa Likver. I'm board certified in physical medicine, rehabilitation, pain management doctor, and I specialize in non-surgical regenerative treatment of musculoskeletal problems. So why we're here today? First of all, I'm sure you're all eager to learn what is physical medicine and rehabilitation medical doctor means. Most of the time, people have no clue about the existence of this field, despite that the field was registered in the United States of America as a medical subspecialty in 1947. So we will also learn about what is musculoskeletal disorders and when they occur. We will learn what we can do to prevent them, and we also will learn if they do occur despite our perfect behavior toward ourselves. What options do we have, what healthy options do we have to reverse the situation and regain our pain-free life? So first of all, physical medicine rehabilitation, it's a MD subspecialty, medical doctor subspecialty, which specialize in non-surgical treatment of musculoskeletal disorders, which means problem with the joints, tendons, ligaments, nerve impingement, and so forth. So physiatrists take care of our musculoskeletal system, which helps us to move in a space, which makes us actually a human being. A lot of people mixing up this name of the specialty, it's kind of like bulky, complex, and not very clear, with physical therapists. Physical therapists, people who manually work with patients, do exercise, like different tissue mobilization. And physiatrists, medical doctors, they actually, after establishing the diagnosis and providing their own and MD level treatment, they also refer people to the physical therapist to have the physical therapy as a complex treatment. Most of the people know physical therapy, occupational therapy, acupuncture, massage therapist, and if those treatments not help, not enough to get the symptom under control, people go straight to orthopedic doctors. Everybody knows orthopedic doctors. And they're doctors, medical doctors who train to help with the musculoskeletal problem with the surgery. But in reality, there is a huge territory in between, which belongs to physiatrists, which can help to get the situation under control in a peaceful way without knife. The fundamentals of the field of the physical medicine and rehabilitation originated during ancient time, and the history of PMNR crosses many cultures and geographic boundaries. So when people do know about the existence of physiatry, most of the time they're able to avoid surgery and have their pain-free life without going through extreme procedures. So main reasons for the musculoskeletal disorders. First of all, our modern lifestyle. So there is price for everything. So we do not hunt our food anymore. And we do not have to go to dig in for a lot of fruits and vegetables. We can just buy it in the grocery, or most importantly, we can make a phone call and food will be delivered to us. And we most of the time sitting at the desk for whatever job we do, most of us do not move in the right way, or if we do move, we usually do it awkwardly and using a lot of technology, using lots of machines, most of the time computers and cell phones, going like this, the face down, posture down, and it takes a heavy toll on our musculoskeletal system, and our skeleton, and our tendons, ligaments, and our muscles, and they become weaker, they become disbalanced, they lose the ability to talk to each other and keep us in the right posture and work synergistically. And our body can compensate for long periods of time, but when compensation ability are exceeded, we all of a sudden start to have symptoms. But in reality, we have it because we were abusing our body without thinking about proper movement, and we start to we damage ourselves and eventually develop symptoms. I'm even not touching the quality of our food and how we eat. It's beyond the scope of my present talk, but everything works in a combination. It's the same body, so everything works as a concert together. The ounce of prevention is worth of pound of cure. It's expression of Benjamin Franklin, and actually he said in regards of prevention of fire, but we absolutely directly can apply to our musculoskeletal system and our health in general, because it's much easier to prevent and maintain our health instead of trying to reverse the situation. So what can we do to prevent development of musculoskeletal disorder? First of all, we have to make sure that our workplace are ergonomically correct, proper. It means the height of our chair should be adjusted to our height. We all have different height. We're not the average person. Each of us unique in all ways our existence, including our height, weight, our that's why the chair should be adjusted, table should be in the proper distance from us. The computer should be in front of our eyes, not to look down, or do not look to the right side or left side entire day after day, year after year, which will force to develop different changes in our musculoskeletal system. So we have to find time to have a break in at least once in 2 hours, or ideally once in 1 hour. Just get up and walk at least around the table. Just move your arms, move your legs. Let your blood go freely throughout your system. It will help you a lot. We have to find the time to not necessarily go to gym, just at least just walk. If you are going to your workplace with a train or bus, just get up one stop earlier and just walk 1 or 2 or 3 couple blocks to get to your workplace. Or when you get up from your work, don't jump in a bus and train right away. Just don't look for the nearest station. Just walk a couple blocks and after get to the transportation. So it will give you a couple extra minutes, and actually, ideally we have to walk at least 1 hour a day. But it's a cumulative effect. If you will get up and walk a couple minutes throughout work, and after that you will walk maybe 20 minutes towards your train station and 20 minutes when you go to your work or home, it will add up to have at least 1 hour walking, which is exactly what your body needs to keep your musculoskeletal system alive and functioning. Also, it's very good to have, in the end of the day, or at least a couple times per day, to have a pleasantly warm or pleasantly hot lay down in a bathtub. It will improve blood circulation throughout your muscles, throughout your body. It will help your body to get rid of waste products. The only thing, you have to be cautious to doing this. Make sure that your water level in your bathtub below your nipples, below your heart level. You always have a bottle of slightly salted water with you, because when you're submerging in warm water, your blood pressure might go down. So you have to be sure that you're hydrated, that you drink a lot of fluid. And if you all of a sudden become lightheaded, so that you will drink a lot of fluid. And if you have somebody else living with you, let your family member know that you are taking the bath, that somebody will watch you, check on you. But in general, if you do it properly, it can really help to refresh your body and help your body to get rid of waste product which were accumulated throughout the day, and will trigger the regenerative process in the system. But despite our, again, perfect behavior toward ourselves, which we're all perfect, I assume, We still might develop pain and inflammation, which are main indicators of the musculoskeletal problem: joint pain, back pain, tendons, ligaments, injury. So our body created practically in a perfect way. So why all of a sudden our Creator gave us these two unpleasant symptoms like pain and inflammation? So why do zebras have stripes? Not for camouflage. Why do fish have fins? To swim. Why babies so cute? So we care about them. So everything in nature serves a purpose. So if we do have pain and if we do have inflammation, so most probably for some reason our body needs it. And we have to respect our body. So why do we have pain at all? So pain has quite a few functions, good functions for us. First of all, pain is a way of our body communicate with our conscious. We would have no idea what if we have anything wrong in our system if we wouldn't have a pain. So when we do have a pain, it's our body signaling our conscious that something is wrong and asking for help. So instead of just taking pain medication and stop the signal, kill the messenger, instead of looking why we have this pain, it's a very immature approach to our health, to ourself. So pain also has some kind of preventing function. When we do have pain, we're trying to protect this area. We do not jump on this leg if we have pain in the leg. We're not lifting heavy stuff. We have pain in our shoulder. So again, when we're taking pain medications, we're not feeling this pain. It doesn't mean that the problem went away. It's exactly opposite. So, but we're using our legs, we're walking, we're jumping, we're doing whatever we're doing, not even trying to give some rest. Or we're lifting, continue to go to gym, we're doing whatever we're doing, pretending that nothing happened. And we actually facilitating, by killing the pain, by killing the messenger, we're facilitating the further damage in our tissue instead of trying to leave it alone, give body some time, let it heal. And if it's not healed completely in a proper amount of time, in amount of time for healing, it's like about up to 3, maximum 6 months. In 3 months, most of the pain, if self-regenerative mechanism goes on in the right direction properly, in 6 months, most of the pain will be gone. In 3 months, most of the pain will be gone. By 6 months, all pain should be gone, should be healed. If we have pain more than 6 months, we call it chronic pain. Any chronic pain is pathological pain. We're not designed to have a chronic pain in our life. So if we have pain more than 6 months, you definitely have to pay attention to it and try to look into the reason for that and try to treat the reason, not just the masking the pain with the pain medications. So inflammation, is it good or bad? How our lawyers say, if we will ask anything, they always say, it depends. So inflammation might be very bad from other issue in our body, but in regards to musculoskeletal system, unless it's autoimmune condition, unless it's immune system attacking our own body, if we're talking about just regular injury, age-related changes, inflammation is the first stage of healing. So let's take a look at the inflammation from the body, from the outside, from the body perspective. So it's a localized, physical, and often painful condition in which part of the body become reddened, swollen, and hot, particularly as a reaction to injury or infection. This is how we see it kind of like outside. So inflammation, the good news is that inflammation is the first stage of healing. Inflammation from inside point of view, inflammation is a part of the complex biological response of body tissue to harmful stimuli such as pathogens, damaged cells, or irritants, and it is a protective reaction involving immune cells, blood vessels, and molecular mediators. So inflammation is a protective reaction, and it's the first stage of healing. So conventional treatments, most of the treatment involve most of the conventional treatment focusing on controlling the symptoms, pain as a symptom, pain medication, cortisone shots, the different type of pain medication, and most of them anti-inflammatory medication. They're killing the inflammation, stopping the medication, not even giving the body chance to heal itself. And surgery, of course, it's a very famous approach to treat the pain. Alternative treatment based on our knowledge that our body can almost indefinitely heal itself. We just have to help our body to go in the right direction and maintain this self-healing process. And there are varieties of treatment like Prolotherapy, PRP, Platelet-Rich Plasma, Prolozone, Neuroprolotherapy. A lot of things could be done to help our body to heal itself. New is the old forgotten one. So technically speaking, Moses was the first person with a tablet downloading data from the cloud. So all these methods which I just mentioned, the regenerative methods, prolotherapy, PRP, blah, 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 it sounds like a new and fancy name, but in reality, the history of these methods goes like to the Roman times, just way like generation before our today's presence. So in Roman times, hot needles were driven into the shoulders of the injured gladiators in order to trigger inflammation, thus facilitating the self-healing process. So idea behind most of the regenerative treatment to kind of like the refresh injury, make the old injuries fresh again, that the body will wake up, immune system will wake up, and will start the regenerative process. So from Roman times to New York times, no changes in human body. So, but the only difference is in Roman times, they respect their body, they listen to their body, they work with the body. But in our time, we are programmed to have a quick fix without thinking what's really is going on and trying to treat the reason. So regenerative solutions like prolotherapy, PRP, it's a regenerative methods trigger good controlled inflammation, thus facilitating non-surgical reconstruction of tendons and ligaments, which most of the time tendons and ligaments, supportive structures of our joints and our musculoskeletal system. And in this case, we can really restore our problem. I'm running out of time, just want to show you this model quickly. It's a so-called tensegrity model. It's a very simple model of our musculoskeletal system. And tensegrity, it's an kind of like dynamic equilibrium between non-flexible firm structures of our musculoskeletal system like bones and flexible structures like tendons and ligaments. So when the system is in balance, we can change the form and body will regain the form. Imagine if even one ligament will be compromised, the entire system will go off. Can you fix that with the pain medication? No. You have to restore the functional structure, and in this case, you will regain your body. So my time is up. I have to finish. Thank you.